My dear students, today I will be taking some of the important points about the lymph nodes. As far as oncogenesis is concerned, we know that many of the cancers, they spread by hematogenous route through blood vessels, and there are some very important organs which have got a high vascularity and their main mode of spread is hematogenous. Now, apart from that, we have got this important lymphatic system in which we have the lymphatic capillaries and the lymph nodes. And lymph nodes happen to be very important for diagnosis of cancers. Now, each organ has got a predilection towards certain lymph nodes. So, today's class will be discussing about the various organs and the important predilection towards different group of lymph nodes. So as far as our knowledge about the lymph nodes is concerned, we already know that the lymph nodes lie scattered throughout the body, and especially they are concentrated in certain regions like the cervical region, like the axillary region, and like the inguinal region. We will not be going about the whole lymphatic system and the lymph nodes, but we will be just focusing on some of the most examination-oriented topics. So as far as the cervical group of lymph nodes is concerned, you know that the cervical group of lymph nodes forms the largest aggregation of lymph nodes in the body. And the cervical group of lymph nodes are divided into the horizontal chain and the vertical chain. And if we go and have a look at the horizontal chain, you know that this is the submental group of lymph nodes over here, the submandibular group of lymph nodes over here, the preauricular in front of the ear group of lymph nodes over here, the postauricular group of lymph nodes behind the ear, and the occipital group of lymph nodes behind. And after that, in the vertical chain, we have the jugulodigastric, jugulo-omohyoid, the pretracheal, the paratracheal lower down. Now, just condensing it, we have to remember that what is the significance of lymph nodes? The significance of lymph nodes is that in certain cancers, which are cancers from the organs, the lymph nodes can be the first involved, and the malignancy can be detected by just having lymphadenopathy. So what is the predilection of different organs towards different lymph nodes? So coming to a very important organ, number one would be the breast. You know, breast C is so common, and the most important group of lymph nodes involved in the breast is the axillary group of lymph nodes. And axillary group of lymph nodes tends to be the commonest group of lymph nodes involved in the breast CA, and axillary lymph nodes lie at various positions in the axilla, but you remember that after the axillary group of lymph nodes, there is this internal mammary group of lymph nodes which also gets affected in the breast CA. Now, apart from this, there can be the transperitoneal migration of the breast CA sometimes into the ovary, into what we call as Bloomer's shelves of the ovary, which can present as a metastatic breast CA. So on examination, you can be having, or on ultrasound or other investigative techniques, the breast cancer might have spread to the axillary group of lymph nodes, the internal mammary group of lymph nodes, or you can be having metastasis in the ovary, especially in case of Krokenberg's tumor. Now, after that, we have got another important involvement. We have got these simple infections which can cause cervical lymphadenopathy. Say infections like common cold, say infections of the ear, say infections of the scalp, say streptococcal throat infections, as well as tonsillar infections. In these infections, we can have cervical lymphadenopathy. Any group of lymph nodes can be involved in the cervical region. Now, after that, you have to be pretty cautious about some associated features in case a person is immunosuppressed and in case a person has got weight loss, cachexia, and other additional symptoms, or rapidly enlarging lymph nodes. You have to be particular about certain important conditions which you have to rule out. And one of the important things, especially in the subcontinent, would be tuberculosis. After tuberculosis, you have to be very much concerned about this condition, HIV infection, in which there's a lot of immunosuppression. In addition to tuberculosis and HIV infections, you have those important group of tumors which you call as the lymphomas. And lymphomas can cause cervical lymphadenopathy. In fact, some of the leukemias can also cause cervical lymphadenopathy. Now, in addition to leukemias, you can be having this very important nasopharyngeal malignancy, nasopharyngeal cancer causing cervical lymphadenopathy. So you have to be pretty cautious to rule out the more severe causes of lymphadenopathy, especially in the cervical region. Now, after that, you have got the gonads, the male and the female gonads, and what we call as the testes and the ovaries respectively. And you have to remember that the pre-aortic and the para-aortic group of lymph nodes are vulnerable in case of the malignancies of the gonads. So the predilection of the testicular and ovarian cancers is more towards the pre-aortic and the para-aortic group of lymph nodes. Then one question asked many a times is the palatine tonsil. Where do the lymph nodes of the palatine tonsil usually go? If they go into the group of lymph nodes which are again a part of the cervical chain known as the jugulodigastric group of lymph nodes, then I have been noticing this question, the tip of the tongue. Classically, why does the tip of the tongue drain into? And the tip of the tongue drains into submental group of lymph nodes. These are very, very important questions frequently asked. And in addition to that, we have got the gallbladder. You have to remember that normally gallbladder is not a common route for lymphatic spread, but the important thing is that there is this important group of lymph node within the gallbladder which is sometimes asked in anatomy, which is called as the cystic lymph node of Lund. So you have to remember what we mean by the eponym cystic lymph node of Lund. So that is the node of the gallbladder. Now after that, you can have sometimes the left supraclavicular group of lymph node enlarged in case of malignancies of the upper GI tract, and that is called as the Virchow sign. So you have to remember that left supraclavicular lymphadenopathy can be an indication of upper GI malignancy. Now, after that, you have to also remember that we have got this very important question sometimes asked: the glans penis drains into. You have to remember the lymph node of Cloquet or the Cloquet's lymph node, but the rest of the penis drains into superficial inguinal group of lymph nodes. So there's this disparity between the glans penis and the rest of the penis. This question I have been noticing that it has been asked with a recurrence. So you have to remember these points essentially. So my focus today was on the particular group of malignancies and the most important group of lymph nodes to which they spread, or even in case of normal anatomy, which is the lymph node associated with a particular organ. I hope that you find and you remember these important tips and important points very nicely, because they happen to be the one-liner sort of questions you will be frequently encountered in your examinations. Questions can be asked about concept, but these one-liners also tend to be an important component of your exams. Nearly, I guess that 20 to 40% of the questions are based on one-liners. Thanks a lot.